Rhinoplasty, or the nose job, is the aesthetic nose surgery. It's very popular in the recent years, and probably it's the most frequently done aesthetic surgery in our country or throughout the world. Rhinoplasty is my specific area of interest, and I've been working on this field for more than 25 years. And I have my own techniques that I've developed and published in international journals and published and presented in many different countries. One is mainly focusing on the tip projection, tip positioning, especially projection and rotation of the tip support. I use the caudal septal advancement technique that I developed. I shape the tip area if there's loss of tip projection in the patients. This surgery is done, again, I will try to briefly summarize the surgical process and the details of the operation. Usually done under general anesthesia, and probably duration of the surgery, depending on the patient's findings, more or less 2 hours. And after the surgery, we hospitalize the patients for 5 or 6 hours after the operation. And then if everything is okay, then we can send back to their hotels, or we can hospitalize one night in our hospital. If there is any deviation or respiration problems, like septal deviation or conchal problems, turbinate problems, we also correct those problems and place some silicone implants inside the nose. Those silicone splints will be removed 3 to 5 days after surgery, and a week after surgery we remove the external plastic splint. There may be few stitches in the columellar area. We remove those stitches a week after the surgery, and when we put some small tapes on your nose. Those tapes will be with you for 3 to 4 days, and at the end of 10 days you'll be free of all tapes or bandages. At that time your nose will look a little swollen. Swelling will decrease gradually day by day. I can say a week after the removal of those tapes, no one can understand that you had a surgery. You can go out for shopping, you can do whatever you wish, but the final shape will be at the end of 1 year. You have to be very patient during that time. There are some critical things you have to be very careful about it. One is you shouldn't use eyeglasses or any kind of glasses. There should not be any pressure on the nose. No trauma, no hit, no sports for 1 month, no heavy sports for 3 months. If you obey those rules, then we get the good result. How we determine the surgical technique, again, depends on the patient's findings and patient's expectations. First, after the examination, I personally try to learn the expectations or complaints about the patients if they fit to each other. I mean, my surgical procedure plan and the patient's expectations fit to each other, then we get good results. If not, if one stands here, if the other here, then patients will not be happy. So, actually the definition of the rhinoplasty has changed drastically in the recent 10 years. We call it 10 years ago making the nose smaller, but now we call rhinoplasty as shaping the nose, because sometimes in small noses we place some cartilage graft to make it augmented, to balance the nose with the other parts of the face or other parts or subunits of the nose. The main limitation of the nose surgery is the thickness of the skin. This is not just like shaping a piece of clay or just carving a wood. We work on tissues, so thickness of the skin is great problem for us. We can only shape cartilage, bone, or some ligaments, shape them, but the skin thickness overlying these structures has a great limitation, because if we try to thin the skin segment, we may end up with necrosis. So in thick skin especially, we try not to make the nose too small. If we try to do too small nose, then the skin will look very puffy. Again, those are all technical details of the surgery. We have to discuss all those things with you one by one, consultation or examination, and every question we try to answer, or every question of the patient.